America is aging, and it's costing all of us. In fact, one disease in particular is gobbling up a stunning amount of taxpayer money every year, and it's only getting worse.
The money needed to care for people with Alzheimer's disease is immense. In Nebraska alone, taxpayers will shell out $302 million to take care of Alzheimer's and dementia patients on Medicaid. In Iowa, that number is nearly double that, $602 million. Reporter Kevin Boughton uncovers groundbreaking research happening right now in Omaha that can someday improve the health for millions of Americans and save the country billions.
Lee and Linda Wollenhop love to travel, but since Linda's diagnosis of early onset Alzheimer's disease 3 years ago, their world has gotten smaller.
Linda, don't you think it's a lot easier for you if we just stay in the same routine at home? It's a lot easier.
Yes.
You know.
Both are retired, but Lee now works around the clock caring for Linda.
The toughest thing is to see someone that you love lose the ability to do the things that they've always done.
Neurologist Daniel Merman says this journey can be exhausting, physically, financially, and emotionally.
It is a sacrifice. You know, if someone's younger, often the spouse would be working and they may have to quit work and be home to provide care. And it's not a one-person job.
There's been a time or two she'd say, "Am I getting worse?" And I said, "Yeah." That's pretty tough to say.
Linda is one of 5.5 million Americans with Alzheimer's disease. By 2050, that number is expected to grow to 14 million. And the cost is enormous. The Alzheimer's Association estimates loved ones spent 18 billion hours caring for people last year, time worth more than $220 billion, more than the GDP of 166 countries.
And if we spend money the way we're doing it now, we're going to buy mediocre care and spend a tremendous amount.
Dr. Steve Bonacera is leading research at UNMC to cut the cost of Alzheimer's care by using something called a care navigator.
The navigators are sort of an ideal person who care about the family and care about the caregiver.
Helping caregivers recognize small medical issues and get treatment early and avoid costly trips to the hospital.
Here's why that's important. Alzheimer's patients with Medicare and Medicaid coverage are admitted to hospitals 3 times more often than those without. And last year alone, the government spent $236 billion on hospital stays for Alzheimer's patients. And researchers here say a lot of that money is wasted.
Every dollar that's spent potentially without getting a lot of bang for your buck in healthcare is a dollar that can't be spent for education or keeping our bridges in good shape or whatever.
Bonacera's project is funded in part by the government as it looks for ways to improve Alzheimer's care and lower costs. Medical experts say navigator programs designed to educate and support caregivers have the potential to save billions and help those like Lee, whose new full-time job is a labor of love.
Caregiving's tough. It's very tough, but I can't imagine what it's like living with the disease.
Kevin Boughton, Action 3 News.